Stroke is the fourth leading cause of death in Singapore. Stroke survivors may continue to have some form of physical disability after their discharge from the hospital. Thus, they may require assistance to roll in bed, get out of bed, and sit up on a chair. It is important that caregivers know safe handling and transfer techniques so as to minimize injuries to themselves and the patient. This video clip shows safe handling and transfer techniques with demonstrations by a physiotherapist. However, if you have not been taught by a healthcare professional before, please make an appointment with one before attempting this yourself. 1 moderate assistance transfer. Position the chair in line with the bed. Make sure that there is enough space at the edge of the bed before rolling the patient over. First, ask the patient to hold onto the weaker arm. Next, bend the opposite knee. With one hand on the pelvis and the other hand on the patient's shoulder blade, ask the patient to roll towards you with you guiding as necessary. Next, ask the patient to use his stronger leg to bring the weaker leg over the edge of the bed. Stabilize the patient's hip and ask the patient to push up to sitting. If the patient is sitting too far in the bed, shuffle the patient's bottom forwards. First, lean the patient on the right and guide the left buttock forwards. Lean the patient to the left and guide the right buttock forwards. Ensure that both of the patient's feet are placed flat on the floor. Place the chair near the patient's strong arm. Ensure that the brakes are applied. Stabilize the patient's knees between yours. Lower yourself to the patient's eye level by bending your knees but keeping your back straight. Communicate to the patient what she is about to do. Patients can place her strong hand on the armrest of the wheelchair. Ask her to participate by leaning forwards and turning towards the bed to bring the buttocks across to the wheelchair seat. Make sure that your path of view is not blocked by the patient's head. Cue the patient's timing by saying 1, 2, 3, up. To transfer, lean the patient forwards, pivot at the patient's knees, bring the buttocks over to the chair. Assist the patient to sit well back into the chair. Make sure that the patient is sitting up straight at the center of the chair. Make sure that the foot plates are secure. If you have difficulty in transferring your loved one affected by stroke, ask a doctor to refer you to a neurophysiotherapist. This is available in all the hospitals in Singapore, as well as community rehabilitation centres.